Dr. Sircus, you wrote in your book that the natural way is not necessarily the easy way to treat. One of the main reasons mainstream medicine is so attractive, no matter how dangerous and no matter how much it hurts, is because we do not have to do anything. They do that to us. So how can a person handle that? Get out of this idea of needing to receive treatments to take responsibility for one's own treatment and having the discipline to pursue it day after day or hour after hour during the day. Isn't it an impossible task? People can do that, can break free from the main way of thinking of treating diseases.
That's a big question. A lot depends on it. Well, it makes sense to treat ourselves, take care of ourselves. We have no choice. We have to choose and select our foods. We have to determine how much water we drink each day, how much sleep, how much stress to put ourselves under if we have that option. Um, Disease is a discomfort, it's a suffering, it's a pain that we feel. And there is no magic bullet, so to speak, something that somebody can do to you, just come up to you and tap you on the head or give you some magic pill or cut you open and do some magic surgery. Sure, these things can change us or give us more time or shift our disease from one thing to another, change the symptoms. But whatever it is that's driving our own disease process, whether we have cancer or diabetes, starts with us. And even if we elect to have somebody do things to us, like treat cancer with chemotherapy or radiation or a combination surgery, chemo, and then radiation, which is very often recommended, we still have to take care of ourselves. We still have to treat ourselves. We can be as lazy, if we're lazy and we don't want to take any responsibility, well, good luck. Good luck with chemotherapy. So for instance, try doing chemotherapy while you're dehydrated. It takes work to fully hydrate oneself. One has to become conscious of their hydration level. That takes effort. To drink enough water to stay fully hydrated is not easy. So even if we elect not to take care of ourselves, it is a little bit like committing suicide in a very slow way. Slowly, no matter what the doctors do to us, we're going to slip away. Our health is going to vanish because we do need to do certain things.
So you say that there's no magic pill or magic bullet, yet we basically, as a society, we run under that paradigm that there is this magic pill. We go to the doctor gives us a pill, and that's it. We go home and we take the pill and expect it to heal us. So now you're saying that we need to turn this idea upside down, and it's not the doctor or the pill, but what we do to ourselves that's going to create our health.
Correct, correct.
So thinking about that, and you put that in your book too, you say that even patients that do go to the conventional treatments, either in cancer or any other serious disease, people that do go to chemo or radiation, these patients still have to take care of themselves before their treatments, during their treatments, and after their treatments. This is in your book. And can you elaborate a little bit this idea? Even patients that decide to go in a traditional cancer treatment, these patients still going to benefit from doing your protocol.
There are many fundamentals to health and to recovering from disease that only we can be responsible for. No doctor is going to be responsible for anybody's hydration level. It takes a lot of work to stay fully hydrated. Doing chemotherapy and you don't want to suffer, the extreme side effects. Well, you can mitigate the side effects if you treat correctly, if you fully hydrate the person, if you make sure they have enough magnesium in their blood, in their cells. if you increase their pH. When doctors give chemotherapy, they give sodium bicarbonate. So the bicarbonate, so the chemo agents, which are very acidic, don't hurt the people as much. Don't burn into the cells and to do as much destruction as it can. Sodium bicarbonate is a buffer. Now, that they give it just while they're giving chemotherapy. But a cancer patient who's going through chemotherapy can be doing sodium bicarbonate treatment for weeks before whatever other treatment, during the treatment and after the treatment. Medical marijuana. It helps cancer patients no matter what they do. If they're having chemotherapy and they're having nausea, loss of appetite, or instead of using chemotherapy, use medical marijuana in a very concentrated form before, during, and after. Stop the chemo and radiation and use that as your main treatment. Breathing. It doesn't matter what the doctor does, you have to continue breathing. You have to breathe. Now, you can breathe correctly or incorrectly. If you breathe correctly, it's going to increase your chances of recovering from cancer or any other disease. Why? Because if you breathe correctly, you're going to have more oxygen in the blood and more oxygen getting delivered to the cells, and that is good biology. Now, if you don't want to pay attention to it, well, and people complain, oh, so much side effects from chemo and radiation. Well, if they want to poison themselves and not even take an antidote to the poison.
Majority of people don't know that they have an option of taking things that are going to mitigate their symptoms from chemotherapy. So that's why your work is out there to help these people, help people know that they have alternatives.
It's not even alternatives. There is no alternative to breathing. There's no alternative to nutrition, to getting what the body needs, getting enough magnesium and selenium and iodine, all things that help prevent cancer and treat cancer. There are no substitutes for these things. There's no substitute for a night's sleep. And having the conditions, or there's no substitute for removing the stress out of your life when you have cancer, so the treatments work better. Doesn't matter what the doctor does, doesn't matter which chemo agent or which radiation or what he cuts out. If the reason you have cancer is you're totally stressed out, and you're still stressed out and even more stressed out because of the oncologist and what he's saying and doing, what kind of results do you expect from treatment? What can we expect, or anybody expect? So some people, or maybe most people today, think it's one or the other. It's natural or mainstream oncology. Can't be both. Well, including myself, I would be part of that group. I don't recommend mainstream treatments. Not to say that they don't help anybody. But for the people who do choose mainstream oncology, they're not off the hook. And the doctor shouldn't let them off the hook. There are many things they have to face. And if they don't face it, the doctor's supposed to pick up the tab. Well, that's the way medicine is played. Patients can abandon responsibility for everything. Go to the doctor. Doctor writes a little prescription, or a big prescription. In chemotherapy, we wouldn't call that a little prescription. And you're absolved, like going to a priest. What? There are causes to disease. The disease doesn't happen out of the blue. There are reasons people have cancer. There are reasons people have Alzheimer's and Parkinson's disease. You have to treat those reasons. You have to confront those reasons. And sometimes we have to make some dramatic changes in our life. And whether we choose natural or toxic treatments doesn't change that. Though dealing with your disease and poison at the same time, well, that's brutal. Many doctors through the decades, people treated natural, who through the decades, in the last 50 years, there have been many people treating cancer patients naturally. And almost all of them say that it's one thing to treat somebody who has chemotherapy and radiation, and it's another when you just treat the disease. But life changes, and dietary changes, changes in breathing, changes in basic nutritional profiles, changes in stress, changes in sexuality. All of these things are independent of the doctor and his poisons and his radiation, nuclear radiation, and his tests, and his on and on and on.